Otufo Nyankopon ni hira na nasumdie enkan odehye same wafidie da ITV Apomuden Ye Ahonya dwumadi su ni osomfo Dr. America Cruz mini wadi ehye de na kyese na wotwe no atimi akwa apro enakwasie 7:30 enkopem 8:30 de Apomuden ho ensem Apomuden ho eye dwumadi eye enkomo ene adusan bibesua no eho hiama obi bia same wafidie eda ha enti no don hwe ba ko eda menimi koso se obema wafidie no ada ha na waka me ho na nyina yesua de doctor ne yenye na wafidie so no obeboae amene topic yesu ebeka ho asem no emudo yi obeboae nso so ama yetimi adomusuko na yetimi ate yenyina asie yi na yeho anamon so a yebetimi atu dwumadie yi tena mekan no don hwe ba ko metwa me ho simaketo bia ba me ba na me the topic no atudwa na me guest no doctor manya na fidie nso no ye fiti ye nkomo twetwe no eso koso emu afidie ne na ha me ba sisia Odeshe emenege se wafidie busoda ITV Apomuden Ye Ahonya dwumadie esuni na saa dwumade nyame adom ye major sponsor for Apomuden Ye Ahonya dwumadie NP Herbal and Spiritual Center NP Herbal and Spiritual Center amaso ye no ewo kasoa Antimercy Junction uduru ITV aso hanom a obusa se ohwe NP Herbal ade obibia ebechew baby entry herbal ewo ITV premises no echipe ewo Antimercy Junction ewo Kaswa na wona ohwe adwumadi last week Dr. Entry na mu eba hanom ene ebetwetwe nkomo eda no mebebri edi yehu se yare de yemu ahoro bebri yewo yare a de medical practitioners esa ene de yewo yare nso a obi ono no wakwadere ewo spiritual aspects of Apomuden so no owani odi hu enoma ebia okwaya sabia yenhu no eno no ohwe na an speciality pa adwinimu yare adwinimu yarewa horo te se etwere epilepsy se obi enya ni tiri anase edam aba no so ye kan madness se bia wakotwe cocaine bi anawanom bibi amanabro so na afa ni tirimu no ni nyina no ohwe se obi nso na ofili se obi na ato obi bi aduro ama eno saa me no na adwene enti so ama nani so haja ni nyina no Dr. Entry so the banner so ya obetenete ediama ono ene ye major sponsor fa telephone number yi na ya watimi afre Entry Herbal and Spiritual Center 0244 566 023 0244 566 023 ene yankomo twetwe a yetwetwe nyina no efa se enipa emra yankopon bo wunyini nyina beduru mpanyin fi so a waso aware no se wo ye oba ana wo ye berema ebehia se obenya wo kani na ebehia se uye nipadua no hwehwemu bi ne hwehwemu be na sese wo ye ansana watimi ne new life partner wonya no watimi no akotena se abobra nipa bebre wo bobra ni nyina efi onkora bra be si mra obendiru san pempenso no na ebi wakopeke yare ba ku mienu bi every baby say we aduane diem ana otherwise eno ho komo na ebetwetwen important lab test investigations be na couple amochia foforo no esese mutimi ye fa mo ho ansana matimi agye atum se afedie yenko ware ene enkomo no emu doyie na ebeboa obi bia nso no ntikoso mo fidi nda Dr. Anase Mr. Steven Antobam owaha ona no na bonedin ni info ne din mu doyie na wa kire de kira kwan ene wonde obeboa me atimi asua de doc memo akwa basonko.
Thank you.
It's been a while we met here.
Yes, please.
All right, you're warmly welcome.
Yeah,
and then on Sunday we no otaka bro for na de boy na enkomo na betwetwe ne emudo. You have to go down to earth so that all the people can really understand you. Okay. Doc, you can mention your name again and then you can flow.
Okay, so Midindi Steven Adigun Antobam.
Okay.
I'm a physician assistant, graduated at 2003.
Okay. 2023. Okay. Just about 2 years ago.
Yeah.
Okay.
From Navita College.
Okay.
So.
All right. That's a portfolio.
Yes.
You're warmly welcome.
Thank you.
And then you share important lab tests. SS couples oba ne bema ehie mu foforo na omadɔ mo ho no lab test also mo yansa na omo ahye ring na ankasa ti 5fm edikan ye ka lab test and a laboratory test e dey important ye patch.
Okay, so say you can lab test investigations like things obeko hospital.
Okay.
Ebetwe umoja. Eno ni lab no. Ebetwe umoja na se bia ebeji junso.
Okay.
And I say saliva.
Okay.
And I say something from the reproductive system, maybe from the vagina or something like that. Yedi beko lab. Yedi beshe machine.
Okay.
Na yahwe. Say yare bi wo ho a. Eno ani lab. And I yesan wo other aspect of the investigation, which is the imagery aspect.
Okay.
And una ABR scan B, and I say there are maybe a scan, ultrasound scan, CT scan, and stuff like that. X-rays.
Okay.
So they are in two parts. We have the imagery aspect and the blood or the bodily fluid samples.
Okay. And then you be ni nyina.
Yes.
Se mrema e ho kwan a.
Yes.
Okay, ti bi di kan hwe lab test no. Uchire mu se lab test no, ye be pick nipa no ho baabi. A che se e ba laboratory test dia, e se se ye nya sample fi nipa no ho sa na kire.
Yes.
Okay. Enti lab no ansa na be kọ die ehia pa e se couples no eye no. Obu ono mo a oyare na okọ hospital, e bia bi fa se typhoid, e na o se suspect se eye no. Obeko hospital be the lab test ba ku bi ono no akire ya bi a hospital call and anje no okọ be fufuro no okwa wo se me call hospital we omo ye lab ni nyina lab bi also me bi omo ye me lab no eye one particular form of labs near ya na say emu different types.
Yeah, we emu different types. There were a lot of different types of lab tests. Depending on history. Ebi a consortium doctor no bisa wasem. Then a year otipa o yem ye o ya na de. Based on what you tell the doctor, that will inform the doctor the test to do.
Okay.
Ebi a nya o kan yina no doctor no na adwini say ebi a wo junso mu yare and an infection in the urine. So onji moja ebi a onji moja. Obeka che o se collab na koye test. Udu ha Omega say call washroom na call junsobra. So they will take the urine and then they will do it.
Okay.
So basically we cannot do all the lab tests for one person.
All right. And the whole best also
except of course maybe a nipano banners or see the person me a full body screen.
Okay.
Okay. There are some that are not important.
Right.
They are not necessary for the person to do, and we won't do those ones.
Okay. Okay, but was what she say afi no do afidie ato ha afi mpu na ye fiti ase kra na Apomuden Ye Ahonya dwumadi se ne osonfo Dr. Medi Dwumadi o chama ene yenya Mr. Steven Antobam or physician assistant or ba boa me asua ade efa investigation hwumu ahoro a se couples amohia foforo amopesa motena afebo nye se mokọ awari mu no lab test ahoro any investigation bi se moye efa mo nipadua no ho na etimi inform mu decision se yenkoso na yenko ware dog yen sembre no normal ye beka ho asem dawson tie fiti ase yen hwe lab test no what are the basic ones na fe yen to aso.
Okay, so the lab tests are many, the investigations are many, so I will just group them and then try to explain the ones that I can explain.
Very good.
So looking at the lab tests or the laboratory investigations, I will group them into infectious screening, genetic screening, and then we also have the fertility screening as well.
Yes, most group into what? Infectious screening. That's the ABR and more be the bar, organism the bar. Yeah. And number 2,
genetic screening.
Genetics, okay.
And then we also have career screening, and other stuff.
All right, Yanko.
So I would like to start with the career screening.
Okay.
So a career screening a lab test ma obia ABI suspect say and I say we want to check if the person has a certain kinds of genetic disorder. So genetic disorders are conditions that you inherit from the parent.
Okay.
And yeah, you have sex with somebody or you went somewhere like COVID-19 or something like that, you can get from the environment. This one is from the parent. So the mother and the father, they come together, they give birth to you. In your bloodline, your genetic makeup, there are some disorders that can come up. When we do this genetic screening, like the carrier screening, for example, we can identify that, okay, this person has this person does not have this, and definitely is from the parent.
TMA example, yaya bakuminu bena yaya carrier screening.
For example, we have the cystic fibrosis, and then we have the sickle cell disease.
Okay, I think the sickle cell the nipa do donate.
Yes.
Enti eno no mo yes lab na. Dien pa na ye.
So sickle cell disease is a genetic disorder that affects a particular gene, which is the HBB gene. So the disease itself affects the production of hemoglobin. It affects production of hemoglobin. Hemoglobin is that protein that is responsible for carrying oxygen in the blood.
From a pa nipa hemoglobin na define nipa.
Yes. Into say yes, our genetic screening now, and I say carrier screen or whatever it is. We'll look at the hemoglobin. We'll look at the shape. We'll look at the genes. If that particular HBB gene is affected, they will know that definitely this person has this condition. And now, yes, some different types of it. But the carrier one I'm talking about is those people who have not the full defect. But they don't have signs and symptoms. So they don't fall sick. They don't. So somebody will tell you that, oh, me, I'm fine.
Exactly.
I don't have sickle cell. But carrier. So carrier simply means that they have the genetic disorder, but it is not a full defect. So they don't have any signs and symptoms. They just do about that. They hardly fall sick. So they don't have that. But when we talk about those who have the full defect, like the SS, the SC, and stuffs, signs and symptoms.
Yes.
But the carriers, they don't have. So somebody who have the condition like the full defect knows that he or she has. So even whilst going into the marriage, the partner should be aware that they have. But what about somebody who does not even know? He has never been sick. This investigation and I say, okay, nipa will or genetic defects, do not full defect. The reason why it is important to do is so that you know your status and then your partner's status. So because there's a percentage chance that you can give birth to a full defected child. So let's say the both of them are ASAS. When you get married, there's a 50% chance that you give birth to an SS child, which is a full defect.
Say, just as you said, before you say I do, before so be just me say yankwa aware mu no, obu on ma matena bia a year or two, omo ahwe, omo suban no bibia hu say bibia akoyie. Emom edu married time na ankasa na afi na o meye sa labi. Simon o ye no hu say obi o ye career, oba no say ye career. And I then say you can split them up.
Yes, it is difficult.
At what point now you advise said people should do this kind of career test?
You cannot say that you see somebody today, you do the test today. So, I mean, if you know you are going to be serious about the relationship, there are certain things that are important to do, like going to see each other's parents. In the process of doing that, the wedding ring has not come inside. You can typically think of doing it. But let's say you didn't think of it. The marriage is around the corner. And then you've come to the hospital, we've tested, and I will say, okay, we are carriers. What should you do? If you ask me, my honest opinion is that, will you be happy to see your children suffering? Obeko Ejuma, the whole full month, all the money you get, you bring it to the hospital to take care of your child. It is difficult for the parents, it is difficult for the healthcare workers seeing a child, probably in the 5 years, 2 years or whatever, suffering because of the parents' decision.
So if some people decide, say, obi mo so you imagine say, okay, our end, you be so worry. You be bomb na first one, you say a be fine.
In my body,
second one,
in my body, there.
And my body to me, Bibisa.
Oh, I believe in God.
Okay.
I mean, I believe in God, but. Okay. Medically, I'm not a pastor.
Okay. Medically, risk, no?
Medically, okay. I will advise you that the best decision to take is not to focus on your emotions, your feelings. Okay. Think about the future of your children, how your children will suffer, how you yourself you will suffer, and then make the right decision.
All right, that's fine. You know, career test and our screening. No? First one, sickle cell, cystic fibrosis.
Yes.
And also who here pa?
We have a lot.
There are a lot of
but
them. Okay.
I just want to stop on the 2.
Okay.
Cystic fibrosis area affecting the respiratory system.
Okay.
And the digestive system. So you see a child. The parents definitely the parents have these genes there.
Okay.
They got it from their own parents. They have it. They are not sick.
Okay.
For example, just like the carrier of the sickle cell, they are also carriers. They are not sick. They've never been sick of it before. They get married, they give birth to a child. Every day pneumonia, every day respiratory distress.
Okay.
From childhood now, always having issues.
All right.
Digestion difficulty.
Okay.
So why not do this test? We identify it earlier. We know that this is the condition that you have, and then we prevent it by telling the both of you not to get married.
All right, that's fine. And you want to by telling the both of you not to get so simple. All right, dog. You call another form of lab test apart from career screening, you know.
Okay, so infectious screening. Infectious screening are in different cases.
Okay.
For example, we have the infectious diseases.
Okay.
You get from direct contact with an individual.
Okay.
For example, let's say body-to-body contact, sexual relation and all that. There are also some that you get from the environment.
Okay.
There are also some that you get from animals. So what we do is that we take your blood sample, we can take even your sweat, your saliva, fluid from the vagina, we take it to the lab, we screen it, and then we know that, okay, this is the condition that we have.
Okay.
What the problem is that because some conditions, some people don't want their partners to know that they have it.
Okay.
Now, we have these issues. Keeping of secrets, they don't want their partners to know.
Okay.
Sometimes it's not even about the secret. They are just ignorant about the condition. They don't know that they have it.
Okay.
Which is one of the important reasons why you must do the test.
And you know, what can you say, you know, say your test be your honor krana. Depend on person partner no cry.
Yes.
Yes. But community be paying from your practice.
For example, maybe a patient who has HIV.
Okay.
The patient is aware. Say onu dey or HIV.
Okay.
But on pese
the partner
no be.
Still na person we run the basso.
Yes, we have ladies who got married. They have the condition. They got married because they were on the medication. We were not worried that they can give it to their partner and all that. But along the line, they stopped taking the medication and then they gave birth. The child has the condition.
Okay.
They did not tell the child. They did not tell the partner. So the child was around 17 years old. We were doing health screening around and all that. Then this child was identified.
All right.
The child got to know. And then the whole life of that child was just disrupted.
Okay.
So even though it is confidential, it is advisable that you tell people who are around you, somebody that can help you.
Okay.
Most importantly, your partner.
Okay.
So it's not only HIV. We have the syphilis, we have the gonorrhea, we have chlamydia, we have a lot of them.
Okay.
But then one of them that I would like to really stress on is the human papilloma virus screening.
Okay.
A lot of ladies does not know about this condition.
Okay.
And it is one of the leading causes of cancer in women in Ghana today. One of the leading causes.
All right.
Human papilloma virus. So there's a particular test that we do. It's a very basic test, pap smear.
Okay.
It's a very, very basic step. Any female in their reproductive age,
Okay.
you started having, immediately you start having sex. Whether you have one partner, you have two partners, it doesn't matter.
Okay.
You must screen for this virus.
At least within a year, how many times is it?
Or at least once every few years is okay. It's not like something that you should do often.
Okay.
But at least you should screen for it. You should know your status.
All right.
Maybe every 2 years, every 5 years, or something like that. Yes.
Okay.
So it affects the cervix of the female. Yes.
Okay.
It affects it, and then you see it starts very minimal. It's just a normal virus.
Okay.
That many people don't even pay attention to. Before you realize, it turns into a cancer.
Okay.
And that is where the problem starts from.
Okay.
It's mostly seen in elderly women because the virus will take about 10 years.
Okay.
Once you get the virus, it will take about 10 years before it fully develops into a cancer.
Okay.
You have a lot of time to do the screening, identify it, and quickly treat it.
Okay.
Now, after that 10 years life span, it begins to turn into cancer, and that is where the problem is.
Okay.
The youngest I've seen so far with cervical cancer was I think 35-year-old woman.
Okay.
When I asked her, she said she has never heard of human papillomavirus screening or whatever it is.
Okay.
This is why I'm taking this opportunity to share this.
And the country.
It's the opportunity I menya sisia, and I mean you to say, if you are in your reproductive age,
yes,
me paucho, go hospital. They do it everywhere. Health care center, hospitals, wherever. Kohona kachom so obeye pap smear and now obeye human papillomavirus screening.
All right. And we know you can't a infectious disease test now.
Yes.
We need the what's done out say major thing the door and skip you,
including HIV too.
Including HIV. Yeah. Syphilis, no, so what they can bubble. So
yeah.
It's a couple no be sure say now they are also getting to a married time now. And when we are omra. Omomra individually because of sending kind of go on oba no who the one who on the send parts and be who. And you always want say they will come as a couple.
Okay, me idea ni say medical screening for couples.
Okay.
It helps build trust. One, it also helps build a strong sense of understanding of each other's medical status or medical history.
Okay.
So, for example, my wife Obi, my name medical history. I don't know whether she has ever gotten an infection before.
Okay.
Then after marriage, you are finding it difficult to give birth. Or you've gotten married, the lady has had an abortion before, for example. You are finding it difficult to give birth. The lady is aware that she has a condition that can lead to such.
Yeah.
I am not aware. I have not prepared my mindset for such a situation. And now we are in the marriage.
Yes.
I will be thinking a lot of issues will take place.
Exactly.
Now, if eventually you call hospital, now say you test.
Yes.
Now say finally, I get to find out that this is the reason why we are not able to get pregnant and give birth and all that, and it is your fault.
Okay.
Basically, the trust in that marriage could be affected. So it is me. I advise that you build confidence in each other. You come to the facility, we do the test for you. Where the problem is that if after doing the test and all that, there are problems, and you don't get married, and you have to go on your separate ways.
Yes.
What will that person go and say to someone else after and all that? That is where each other, you have to come together.
Okay.
Have an agreement that this is for our future. We need to do it. Whatever happens within us is confidentiality.
Okay.
In addition to that, whatever test that we are doing, we are not doing it together for the two of them. You guys will go into the lab separately.
Okay.
So when you come, the result comes, we look through.
Okay.
We know the ones that we can share to the two of you. We know the ones that we have to call each other, each person in private. And then after discussing with you, we ask you, your partner na say won pese ye beka chem so wo pa ye beka chem wo penso aye nka chem wo mo amudu fia na mo akosoto mo how
you know briefly sa lab test for infectious disease lab test just so mobile almost all the infections now.
Yes, please. So long as it is for that purpose, for the marriage purpose and all that, yes, we do it. Though it's costly, we discuss the prices with you and all that. Then, if you are ready, we'll go along with it.
Okay. Yo, what is your manager be so feeding goods that me say usia ade name mo channel so o akonya say edu me be the telephone number beto feeding na say no afre mra e wo seti so na wobusa a question bia e boda o mind e fa enne enkomo a ye twetwe no ti kosoma ofidi na ha e beje nkrato si market wa bi aba e ba na ye ne doc atoa ye dusua yesua no so kosoma ofidi na ha e ba sisi a
and Ebusu Damansoa. What is your senior pedianani? Now, so media, Mercy Skin Care Products. Manage the whole say, and my meridiania moton. Nothing so, and knitting wine. A bra, made one summer and a titru, a jerry papadieri. Send a mini pediano who hear minty, and send a media da. Mercy Skin Products. One summoner, any one kuno. Some of the sramitrimua, and mommy train you in a 2 year. Nothing so, if we Ayare what to say, and for nini, and answer pimples. A yam, and so once I weber say ni pedianani, and I feel so. Yarewa, it's me behani pediano, Emma a say, a year through. So pen the do to Frey 0202 511 214, and answer 0243 250 702. Mercy ointment, Shishako Puam Samoa. Money pediana who fe a daddy.
Sada boy Ghana Food and Drugs Authority aye munhwehwemu edi wonsa ahyase.
Manager be so feed you so that ITV Apomuden Ye Ahonya dwumadi so ne so for Dr. Ahmed Kokos media dwumadi ho chiame channel see stream live ewo YouTube ITV Ghana ewo YouTube Samson dwumadi man
talked about the genotype and all that, but I think if we had enough time when I was talking about the sickle cell and stuff, I would have talked about it. So the first one is the blood group. It is important that every man, every woman is aware of your blood group. Whether it is A, B, or O. It is important that we are aware. You see, most of the times we are humans. What do you mean predict it say in few minutes or in few years time or whatever, this is the position that you will be. Anything can happen at any time. For example, a patient has an accident, has come to the hospital. Besides, say, okay, blood group missing. There is no family members around. We also don't have a proper system in place to track every medical history across healthcare systems. And now, you, this patient, you are bleeding. We need to transfuse you. Yes, we have the universal one that we can give, like the O neg and all that. But let's say we don't have O negatives available. We don't have relatives available. And then also, you are not lucky. The lab is not able to do your genotype test for you. And we ask you, what's your genotype? You don't know. So you are going to hinder the ability of the healthcare professionals to actually help you. Internet, we advise that it is important that every individual knows their blood group. I've seen patients, elderly people, you ask them, what is your blood group? They are not.
The blood group, yes,
please.
So you say the blood type.
Yes,
or blood group.
Yes.
So A, so B, so O, and AB.
Yes.
For it also to me what they
very important.
Okay.
Whether you are a couple trying to get married or not, this one is important.
All right.
But in the case of couple, it is also important. When you know your blood group, you know that okay, this person is A, I am also A.
Okay.
You know the combination that you are bringing on board.
Okay.
In addition to the blood group, there is the positives and the negatives on top.
Yes.
Which is the A positive, the A negative, or whatever.
Okay.
That positive on top is what we call the resource factor.
Very good.
The resource factor is extremely important, especially in the case of ladies.
Okay.
Now, I was talking earlier about a woman getting married to a man. They are not able to give birth because she had an abortion previously.
Okay.
Now, it is common among men to have resource factor being positive.
Okay.
Like a man having A positive, B positive, and all that.
The man know A positive,
yes,
B positive, and quite common.
Yes, but for you to get a man who is having resource factor negative, it is there, but I myself have never seen one before.
Oh, okay.
Like a man with resource factor negative.
Okay.
But for women, it is common.
Okay.
Now, if you are not lucky, you date a guy who is who has resource factor positive.
Okay.
You also have resource factor negative. And eventually, you get pregnant for this guy.
Okay.
You give birth, you had miscarriage, whatever it is that took place, so long as that baby was there, the baby's blood and your blood mix together.
Okay.
There is something that is activated.
Okay.
When that particular process is activated, it builds more like a soldier, like soldiers in the body. What these soldiers do is that they prevent they see the blood of the baby like a foreign material, like an intruder that is coming to cause problem to the mother.
Okay.
So once the blood mix, the first baby can survive.
Okay.
They won't have issues with it. But they will activate more like a soldier or a security system.
So this one, we know see emra akrano efa papa no positive. No?
Yes, please.
Okay. Now my men they were negative.
Yes. Okay. Eventually, whether you like it or not, the child will carry the father's positive.
Okay.
So now, once this baby is out, the system is activated.
Okay.
The next pregnancy you have,
yes.
If that next pregnancy is also having a resource factor positive. The likelihood that miscarriage will take place is high. The likelihood that you even get pregnant in the first place is very low. So it is important that as a woman, you know your resource factor and you also know your partner's resource factor.
Okay.
So that if, for example, you've had pregnancy in the past for a resource factor positive man and you are negative and you come to the hospital, there's a particular injection that we give you that can bring down that security system that I was talking about. Until when you come to the hospital as a couple, we do this test for you so that we identify that, okay, you are negative, he is positive, we give you the injection. So that even if you want to give birth to 10 children, no problem. This is one of the reasons why couples who have given birth to first child are not able to give birth to another one. It could also be linked to this resource factor.
All right. I think that is, it really makes sense. But audition minimum say bro for now kind what asiye dia de no pa akire and say blood group no e ho asem na hu hia na de ya hye no so bo no ma obusa na blood group osem ye A obusa osem ye B aso so ye A positive so ye A negative no eya na dodo na no omomfa positive and negative na nka ho de doc wa ha o kire ne say yema eye sa resource factor no eno ho ehia yen say positive or negative, especially a man no yema eno so ehia yen if we say de okan ya mi chiri mu ne say so oba o blood group no eno resource factor na yemfa ne say we A now resource factor na a negative so ye A negative. So ko ware bema na bema na e positive ana one bema one ne te na bia mo hye wo kakra bema na ye positive na ko ba se oba na unyinsen for the first time nyinsen no dodo na no akra na oda wo yem no obefa papa no positive no enti wo oba no ye negative wo ba akra na oda wo yem no de ono no afa papa no positive no enti during the time of a pregnancy no se unya miscarriage sa utime wo ya emu bia no de ba ne se wo ne eye wo ba no wo ne akwa ne mogya ne timihia akwa ne positive na wo ye negative ehia pe na eye system bi atake place ay body no onipadua na be produce asojafo ye from antibodies no omo fa ne se positive na ehia wo yem no eye enemy banyame be ye wadoma ma first baby ni de obewo no kama but onipadua ne de a program say positive fufuro bia e be hye wo yam pe ana efiti ase kra se form pe body ni betimi ayi na pie eno na abeye eye problem akoba sa obi o wo ba ko a na be 5 years 6 years 10 years na sebe obenya second baby no na eden either say nyinsen ne makra ana say unyinsen bi ana say unyinsen bi ana say eno na o chirimu no to chirimu say eye blood group test no ene rhesus factor na fa na positive or negative eno say ye hunu ka ho na emire bia no hunu be ma wo ne wo ho no so hunu ne de na mmoama asetana enye kama dog entino wo de kakra be ka blood group ya asem hu bia wana ana ye beto aso and ye to aso ye call other forms of investigations.
Okay, so next one we person can one asem enu ni the fertility or infertility screening.
Okay,
we know very important for couples. So we want to know ebia wo oba no obetumia awo.
Okay.
And you, the man, you can also impregnate the woman. Whichever way we want to know. So there are certain investigations that we do.
Okay.
So we can take the semen, the sperm, and then we put it under the microscope. There are certain things that we look out for.
Okay.
How the sperm moves, the shape of the sperm, the strength of the sperm, and all that. Inti say you share way na, then we will decide whether you, the man, you have quality sperm or your sperm is strong enough, capable to fertilize an egg.
Okay.
If there is a problem, we have protocols, we have management protocols that we can go through to make sure that the semen is in place.
Emma Obano and Fabemano, how handsome he is.
No,
if it wasn't Mema, I have one channel to Samri, I do say, oh, as in Bisabia, Obitini Afresim, na ye wano. And the number near the to a year if he didn't say, and no, and away if he didn't say, no bit me a na what me afraid. I already saw bit my friend Ajoko. Okay, dog.
It is a
10 gram.
No, you have or you have no. It's about say a bit to me about sperms no and yakra. The shape is not nice, the motility is not nice, and all that. It is a only bema we share, na say Owarina. Obeun say you do the do, but the do will not produce any positive results. Okay. Simply because though ni uyefe, but sperms no any quality. Okay. And I say ni quantity no and drew dodoa ehunya se nebeya ebetumi aye fertilization na. So it is important that we do this test for the man. Some men don't want to do it, but it is important that it is done. Other ones that we can also do is the hormonal assay. Hormonal assay no tester we moja. Then we'll look at the hormones. We'll look at their levels. Your levels are
Doc, Obiafre. Okay, Mr. Charles from Teshi. Good evening. All right, that's a part. Oh, I said, Mr. B.
Now, concerning the blood group, no, never say me O positive. Okay. Obama one so an Obama Siano and so O positive. But you feel like a buana.
No, what's in the question?
Yes.
Oh, okay. Yo, that's what your question to be you and why. We are not to someone, that's a pair. Mr. Number now, your friend, 054-793-2494. 054-793-2494. Obetimi afre Simon dog. Ebi abeyi na no quickly near to us.
Yeah, so only Obano you're positive, any problem.
Oh, okay.
You can get married, you don't need any injection or whatever. But the problem comes in when there is a negative.
So yeah, I a lab test like sickle cell the okay in the blood group. I say also Obano share and also busa first no. And sana was in the pepper. And
genetic disorder there any sickle cell pet.
Yes.
So you can also look at the person in the face.
Can there be a card like a national card? Be a best idea. No.
I just say government.
But tissue or domo adding. So can so
but
okay.
You should also, like I said, put the emotions aside. Don't even think about yourselves. Think about the children.
Yeah, very important. Now, all my points being so. Now, all my points being.
So I was talking about the fertility screening.
Yes. Okay.
And then I've talked about the semen analysis.
Exactly.
I was on the hormonal analysis or the hormonal assay.
For the male or female?
For the female.
For the female, okay.
Yes. So the female hormones, though you can do for the male too.
Okay.
Because the hormones are responsible for all the stuff that go through, like the the production of the eggs,
yes,
regulation of the menstruation, even in men, the production of the sperms and all that. So all these hormones, when you do the lab test and you see what you are looking out for is their levels. If the hormones are too high, some of the hormones are too high in female, it can cause infertility. If it is too high in males, it can also affect the semen production or quality or whatever. Now, for example, let's say there is a particular male hormone that is also in female, but the level is very low. If it becomes too high in the female, it can definitely affect the fertility of that female. So you get married to a woman and she's not giving birth. They've done the scan, they've done everything, they said everything is fine. The man to be fine. But maybe you have forgotten about the hormonal assays. When you do it, it will tell you the levels. It will tell you the levels, whether something is too high, something is too low. Then you boost it or you do something to bring it down.
Unless I know so in row.
Yes.
All right. So this is the dog actually mono or kind of bro from the upper channel say about a man or susumwa. Ye share our hormones be a boa emma awo eba. Na ya na dodo na fa na se makotwa scan doctor se hwe nyame e bia na arefia ba se o se yesa fertility hormones no eno no mumu no betima ba se eno na esi ho kwan. Okay, doc, Nana ya aba line so yenti no. All right, Nana ya from Accra. Hello, good evening.
Hi. So we check your blood group now.
Yes.
For blood, no na mube is any some petty things become.
Certain things
to say then.
Say, yeah, we check your blood group now.
Yeah, anything. Okay, we see who can first say blood group. Yes, sir. You and I, that's be brave because some of it now. Look, really answer quickly.
And I say over call hospital. Now I catch you say ube blood group test.
Okay.
Ye bedroom moja.
Okay.
The be call lab. Now you check it under microscope and all that. Ye the best machine now you check it. Then they will tell you if our blood group you're A positive, B positive or whatever. And one.
So say blood group the moja na bit matchroom, bit me quite pricky on sa no normally attack. Okay, look, I think you can also move on to then as I said we are done with the fertility hormones.
Yes.
Okay.
So the next one is the images.
Images, okay.
So you can do scans like abdominopelvic ultrasound scan.
Okay.
What abdominopelvic ultrasound scan is looking at is the reproductive organs.
Okay.
And some other aspects in the abdomen.
All right.
So we look at the uterus, we look at the cervix, we look at the fallopian tubes, we look at the ovaries.
Okay.
If there are any problems at all, we quickly identify it and then we take care of it.
Okay.
There are women who have fibroids. They are never aware that they have
fibroids. There's another caller on the line, though. Sorry. All right. Hello.
Hello.
Yes. Good evening.
Good evening.
But you didn't say
we are O negative. Wow, cholesterol. But you bet me I say and I say this is why we
okay, that was so say oh husband unim ne de be man na net no unim ono so blood group.
But you me fika kra.
Okay, nke hu eno anka obetimi ayi wano yi pa but I think say obusa ne sa ne de.
Ono de ani oh, now and I mean say negative positive.
But what the way you negative?
Patron.
I know I was three that.
Patron.
Okay. All right. Dog with you and why?
Yeah.
So on our team or 3. But what kind of negative in time say is Ruby Avenue? And I said
the fact that you've been able to give birth to more than one is a sign that probably is either the man is also a negative, which is not common,
okay,
or and the hospital that you went to give birth to, the first or the second child, they've done a very good job by giving you the injection I was talking about.
Okay.
Once the injection is given, you are fine, you are good to go.
Okay.
So sometimes they will tell you that this is what is going on, and they are giving you this injection. Sometimes they will not tell. But then when you go and do it at the couple screening, that one you will know instantly.
Before say we call our okay. But you this say no ebe adwuma. Dog now we can images no. X-ray ho ehia na.
X-ray, not really.
Okay.
Not really.
Na MRI, CT.
No,
those ones are not necessary.
No. Just for the females, you can do the pelvic scan, or the abdominal pelvic scan. That one will let us see the reproductive organs.
So question me about na so for questions abenya na ye reply mood. Or since investigations we anyhow and a lab test we anyhow be oba na betimi ede ehu se be ma no ne be ma na kasa ye adwuma. Wait, be ma na 10 gram pa. Baby be compound na koyu. Lab test we anyhow I see to me.
Oh. You see, when it comes to issue of whether premature ejaculation or
dog, Sister Kuya from Teshi.
Okay.
Also, or question me pa dog. All right, hello, Sister Kuya from Teshi.
Hello.
Yes, good evening.
Good evening.
All right, that's a say what friend. What your was in Bisabia Kosomai.
I can say O negative. Hello. Dr. Sorry, O negative. No, this is O negative. Don't make me aware.
Yeah.
And doctor say, Anne, umbit me aware. Why? Okay. All right. Yo, that's a pass of Frey. Also, next or ban or O negative. The money O negative. On the business some with my worry. Or say okay.
Yes.
And see, so a B or whatever. A negative, no, is a negative as in being home. All right. Okay, dog. Into I think now, when I know we are no, say Ubia or person who say, ne Bema was Shiano for front, and the Bema ye, Jumansano acquire. Because say religiously, no sex before marriage. And it's a particular, the most important lab test was a Kabuyu. And also, then a bear for home. Lab test be anymore.
Is it talking about how long the person can last in bed or premature ejaculation? Which one? So with the premature ejaculation, you have a lot of tests that can be done.
Okay.
But when it comes to how long the person can last, you have to try.
Now, like erectile dysfunction, malfunction, and so on. And also test be anymore.
But how will you know if the thing is not rising? You have to do something.
No, see, yeah, lab test no. Or no, say the Indiana pa no, no. Because yes, I win na say sperm na yadwuma. Simene okay, BBI fine. But beko na say BB I mean pija. All right, there's a caller. Last caller. Hello, good evening.
Hello, good evening.
Yes, please. But you did this and I can friend.
But your friend, my man,
very good. Yeah, that's a pa. Oh, I say we say be a customer.
And the thing is, I say, O positive.
Positive.
And Obama O positive, Obama say O positive.
Oh, and some to it. So, I'm positive.
Yes.
All right.
Yeah.
All right. And that's a pa. But you are not sincere, why? Dog, also mean positives. You know, I don't know. I have do a one.
Oh no. They can get married. Yes.
Okay.
That one there is not a problem.
All right. We said the last year, dog will chat to no will be the question now. Nipa na send a message no. Ubisano. You know the you know your number no my.
Okay. So with the erectile dysfunction, there are many things that can come into play.
Okay.
For example, the hormones that I was talking about. There is an hormone that is responsible for activating the blood flow and all that to the penis for the rising and all that to take place. So when we do this hormonal test, we see if the level is low, then we do something to increase it. There are also people who are battling with some health conditions that can lower the strength of the manhood. from rising and all that. For example, diabetes, for example. So diabetes can affect the rate at which blood flow.
Okay.
When we talk about erection, erection, we all know that the penis is not a bone.
Okay.
It's a muscle.
All right.
And then what causes the rising is the amount of blood flow, the rush of blood flow to the penis. Now, when there is a reduction in the blood flow to it, it affects the strength, it affects how it rises, how long it rises, and all that. And one of the complications of diabetes is what we are talking about.
Investigations
so you can screen for diabetes.
Okay.
And there are also some medications that the person may be taking for different conditions. This is also common in adults. I mean the elderly men, especially those who have hypertension and they are taking certain kinds of medications. They can have this complaint that they are not able to last long in bed.
No, better was say emrena so enso intino last words be a futu be a we can pure trip 3 seconds pe come na me advice.
Okay. So advisor midibema obiani say before you say that you want to get married, before Awobeka say I do, it is important say Awobeba hospital.
Okay.
Wuni o partner.
Okay.
Ama be hu doctor. Ama catch you say say na course.
All right.
Ye pese ye lab na ye share. Problem bi wo kwa.
Yo.
Na ya check your amount.
No, okay, better was ye pa. You hu wache. Timigidi say from and then the better ehun afidi. Sure. Better was ye pa. Okay, into other share manage say mo afidi no eda ha don hwe baako eni na hye no so na ehiama say ka nya ne ba SRC o mema health to the bits bi. Then no mo elite. Nyame adma next week o mema ntem o me health to the bits no. Okay, other share nyame adma next week so for Dr. Ahmed Kwaku so mesan we de ahia e wa afidi. So next week 7:30 nemom eye ukwada 1:30 for affiliate to ITV. Obenya repeat of this show. Bye.